Well, good evening. I am Yolanda Johnson. I'll be facilitating our discussion this evening. We are here to talk about Critical Conversations, a cancer learning series. This cancer learning series is hosted by the Oncology Foundation of Maryland and the District of Columbia. The mission of the Oncology Foundation is to bring together in a non-competing forum patients, patient advocates, doctors, and the research industry to provide education and information on available cancer resources. This is forum number 4 of Critical Conversations, a cancer learning series. You can find the previous forums on our website. There are 3 main goals of the Critical Conversations. Goal number 1, to provide relevant cancer education to the public. Goal number 2, create an accessible resource library. And 3, to build a community of support for cancer patients and their families. Thank you all for being here this evening. I want to take a moment to introduce our speaker this evening. This evening, we're going to be talking about Caregiver Support with Dr. Sherry Cormay. Dr. Sherry Cormay is a licensed psychologist. She is a certified bereavement trauma specialist. She's the author of 2 psychology textbooks and a recent self-help book about loss and grief called Sweet Sorrow: Finding Enduring Wholeness After Loss and Grief, which she wrote after being a caregiver herself to her late husband who passed from cancer. It is an honor for her to be a volunteer at the Annapolis Wellness House, where she currently facilitates and manages the Caregivers Support group. Some interesting things about Sherry is currently in Santa Cruz, California. She's been there for the past several weeks supporting her daughter and being ran around by her grandson, Hank. And Hank is 3 years old. Welcome, Sherry.
Welcome. Thank you, Yolanda. Thank you for everything you've done. Thank you, Lisa. Thank you to the Oncology Foundation. Thank you to all the participants that are here tonight. Thank you to 3 wonderful women from the Wellness House Caregivers Support Group that you'll also be hearing from tonight.
Absolutely.
Thank you.
Thank you. So Sherry, let's talk a little bit about, before we move forward in the program and hear more from folks with lived experiences as caregivers, let's talk a little bit about you.
Okay, I can do
How
that.
did you become involved in this work? And then I'd like for you to follow that up with, what is the role of the caregiver? So first, how did you become involved?
Right. So that's a great question. I was about 16 years ago living what I thought was my best life. And basically one day the bottom dropped out because my otherwise healthy husband was diagnosed with stage 4, probably stage 4B, lower esophageal cancer. And the surgeon who performed the upper endoscopy when Jay was still under sedation said to me, he has 6 to 12 months to live. And he lived for 7 months actually after that procedure, and then he died. But right away, during those 7 months, I became his caregiver. And, I didn't have any experience caregiving. Like most of us, I was fairly unprepared. As we all know, those of us that have cared for people with serious illness or cancer, it's really a roller coaster of things that go on. And so one day, after he had had quite a few rounds of some very serious chemotherapy, he was doing pretty well physically. Emotionally, things were really tough for him, and he would take it all out on me. And so one morning, I just couldn't handle it anymore, Yolanda. And I called the cancer center where he was getting treatment. And some wonderful woman answered the phone, and I said, I just don't know what to do. I've had a really hard morning. Um, I think the chemo's really getting to my husband emotionally, and then it's getting to me. And she said, and I quote, "Honey, I hear this all the time from families, from caregivers with loved ones going through treatment for cancer." And that was all she said. And I liked that she was empathetic. I needed something more. I needed resources. I needed to know how to handle this. I needed information. And so, really, at that very moment, I made a vow to myself to, in the future, to do whatever I could do on behalf of people who are caregiving to be helpful. And that's when the Wellness House opportunity came up to really facilitate the Caregiver Support group. I just jumped on it several years ago because I am thrilled to be doing this, and it's just such an important adventure and venture for me, and I'm so grateful to be here tonight to talk about this. Thank you.
Thank
And
you.
now you want me to go ahead though and talk about caregiving.
Yes,
So,
like the role of the
the
caregiver.
role
Tell
of
us
the
a little bit about
caregiver.
that.
So, I think really what we can say is that most of us, I don't think I was unusual. I think most of us are quite unprepared to be a caregiver. We're often thrust into the role rather suddenly. And we also find out that it takes a lot of time and a lot of energy. We also find out that we have to wear a lot of hats. The hats change, and some of these things we're not prepared to do. Like, we may need to be the loved ones or the patient's therapist sometimes, or counselor. We may need to be a nurse assistant. I'm very squeamish, so that part of it did not go well for me at all. One thing that really helped me is at the very beginning of my journey, a dear friend of mine who knew that probably I was struggling sent me a magnet that said peace. And I feel this is now the caregiver's mantra. Peace doesn't mean to be in a place with no noise, no trouble, or hard work. Peace means to be in the midst of this and be calm in our heart. And I kept that magnet in front of me and looked at that every day.
Thank you. It's a beautiful story.
Thank you.
Sherry, talk a little bit about the emotional aspects of being a caregiver. What are those varying emotions that come along with the role? And then if you can, share some ways in which caregivers or people who work with caregivers can help navigate those emotions.
Okay, great question. And of course, there's a lot of emotions because I alluded to this in my opening story that I was really emotionally impacted by what was going on with my late husband. So the first thing that comes to mind is the image of a roller coaster. Yeah, think about a roller coaster. It goes up and it goes down, it goes up and it goes down. That's sort of how the emotional experience is, I think, of caregiving. We have good days, we have hard days. We have some good emotions, like sometimes we feel very accomplished and we feel like we're having a good time and we're satisfied with what we're doing. And yet we also sometimes feel like maybe we are, doing not so well. Maybe we are lonely at times. Maybe we're grief stricken. Maybe we feel guilt. Maybe we're frustrated and feel anger. And we know one thing about caregiving from a lot of research, although I'm thinking, gosh, isn't this sort of a no-brainer? But we still have to have research, right? The more time we spend in caregiving, the higher our stress hormones flow throughout our body.
Mm.
So we know that there's 3 factors in particular that make our stress as caregivers much more challenging. One is an imbalance between demands and resources. If we have more demands and not enough resources, not enough time, not enough people, not enough money, our stress goes up. If we happen to have a difficult relationship with our loved one's healthcare provider, stress goes up. If we happen to have a poor relationship with the one we're caring for, stress goes up. So how do we navigate all this? It can be hard. It's because our brain has a negativity bias. What does that mean? That means our brain wants to scan for negatives all the time. Negative here, negative here, negative there. And when we're stressed, we tend to believe those negatives. One of the things we have to do, sorry, there's some pollen here,
Mhm.
lots of pollen.
That's okay. Those of us here in Maryland, DC, Virginia area, we know about the
Heard
pollen.
there's a lot of pollen there
There's a
too.
lot of pollen. That's
Yeah.
okay.
So we have to train our brains to scan for the positives. And otherwise, we would be going into a negativity spiral. And I'll give you a little example. The day that my husband had his upper endoscopy and got this diagnosis, Yolanda and everyone on the call, I was scheduled to have a hair appointment. And I realized I wouldn't be able to go because we now had to go to some other places, some other we had to go to a different cancer center to get a PET scan and some things like that. Well, I was really bummed out about having to cancel my hair appointment because you all know, if you're a woman, it takes kind of a while to get in to have a hair appointment with someone. So I was pretty bummed out and I was feeling irritable about it and frustrated. And I could sort of feel myself go in this negative spiral. Like I was thinking, geez, what all am I going to have to give up to be a caregiver now? And I immediately was able to stop myself. I said, I don't want to go down that rabbit hole because I know where that's going to lead. I don't want to start off this caregiving journey feeling that negative. So I started thinking, the interesting thing about canceling the hair appointment was for the last couple times I'd been there, I hadn't really liked the way that this person had been cutting my hair anyway. I thought, you know what? Maybe this is a good thing. Person this week, maybe I won't get back in with them. I'll try somebody new and maybe I'll have a better experience. And actually, I did try somebody new and I did have a better experience. So I want to say, I'm not talking about what we call toxic positivity. Toxic positivity is where we just say, oh, everything's rosy. Everything isn't going to be rosy. We know that. Things are not all rosy. Things are very challenging. But it's like, how do we take the knowledge that we can have bad days and hard emotions and deal with them and still be able to stay in emotional balance well enough so that we don't let negativity rule our lives while we're caregiving. So that's kind of the long and the short of it.
Yeah, I like that. Thank you. Thank you for sharing that. One of the great things that Sherry prepared for us tonight was to bring in some folks with lived experiences. And stories are powerful to learn from, to share, to grow from, and to encourage one another. So we have first up is Eileen Martini. And Eileen is a survivor, a distance runner, and Eileen is described as fierce. Eileen is going to share a part of her story as it relates to caregiver support.
Listen, thank you so much for having me. And I'm happy actually I'm following Sherry because we haven't talked since since this invitation was extended. And what I want to talk about is a little bit about my journey and then more about the positive negative because It's been a crash course. But anyway, so our situation, March of 2021, my husband became a cancer patient and I became a caregiver. And like Sherry was saying, you're just thrown into this whirlwind of fear and anger and frustration and sadness and oh my God, what am I going to do? Um, but there was good news. It was stage 1, and we were going to do all this chemo, and he was going to have surgery, and then life would go back to normal. So that hope was huge for me. And we had a great team at Hopkins right off the bat. So here we are. I'm going to fast forward. We're 2 years and 1 month later. My husband's surgery had to be aborted because they saw cancer, a little bit of cancer in the liver. So game plan changed. And again, devastation, you know, just, I don't even know what to say, like just complete shock and devastation. So I had to pick myself up from that. Okay, what are we going to do now? So we had to redefine normal again. And what was normal going to be for us at that point was him doing more chemo, more treatment, and hoping, he could live as long as possible. He's still alive. He's doing amazingly well. There have been a lot of miracles on the way. But the thing I wanted to talk about were kind of the 3 takeaways that I've experienced through this 2 years. And the first is that it's hard. It's just hard. And I have to be honest about that and not sugarcoat it or put the rose-colored glasses on. Okay, it's hard. And things are more challenging. So I just decided to, like Sherry had to decide how she was going to approach being a caregiver. I decided that because I am a distance runner, I've run lots of marathons. I've been well prepared, poorly prepared, and everything in between with my running. And I just decided I have to have that warrior spirit to get through this and to be there for my husband, to be fierce, to be strong, to be, ask good questions, give him good care, manage myself, take care of myself. And I relied a lot on, this sort of self-talk, managing my expectations, looking at like mantras that would be helpful. This too shall pass is one that I use a lot because even when things are good, like they are right now, I know this will pass. And we may have a crisis tomorrow. And I know that will pass. And it sounds so simple, but it's so incredibly powerful. And it has been very, very helpful to me to be able to say, and this too shall pass. And it just brings me the peace. I didn't have anybody send me a magnet that said peace on it, but that's what brings me peace. The other is to pay attention to when the emotional overload is happening. And I forgot to mention at the start that I'm also a mental health professional. So my training has been helpful to apply it to myself in taking care of myself as I go through this. So there's an acronym, HALT, HALT, hungry, angry, lonely, tired. And that's a check-in for me. And it's been a very helpful check-in for me because a lot of times it might just be about a basic need and that I need to tend to that need. The other things that I do, and I'm fortunate in that I have resources and I have family and I have friends, and my husband is an amazingly positive person. And I asked him before this, I said, is there anything you want me to emphasize? I'm going to be speaking as a caregiver. And he said, to make sure you talk about attitude, accepting attitude. Don't hate the cancer. Look at all the opportunities that have sprung from this experience. It's terrible. I would rather not be here talking as a caregiver to a cancer patient, but he's right. If we hate on the cancer, we're just going to go down that negativity rabbit hole and maybe not get out. So his attitude has helped me manage mine, to be accepting of what's going on. This is happening and we're dealing with it. The B for the ABCs is balance, to pay attention when that emotional overload is happening, to pay attention to my eating, sleeping, exercising, spending time with friends, doing things for me, acupuncture, massage, go to the gym. I have a rotation of things that I do with lots of structure. And then the last thing is the C, which is control the controllables. And that's a Navy SEAL expression. And that's another one that comes in very handy at times, because I can only control what I can control. And I can always be in control of how I'm thinking. I can always stop and control how I'm reacting. Most of the time I'm able to do it. Every once in a while I'm a mess. I fall apart, and that's being human. And I want to embrace that and be honest about that as well. Last, I promise, I went ABC. I'm jumping to G. G is gratitude. Gratitude for so much. I look around and I think, thank God we live where we live. We have access to Hopkins. We have resources. We have family that they're doing well. We actually had a party. We threw a party for our friends, for our families, because of all that they have done to be a part of this journey, and to not, to just lift us up and to share love with them. And that's just powerful. Gratitude, love, acceptance. That's it.
Thanks, Eileen. Those were all great nuggets.
Oh,
Excellent
wonderful.
nuggets. I love the redefining normal. You shared so much there. And just to let you all know that we are saving space towards the end so that you all can also dialogue and have some Q&A with our speaker, as well as our storytellers today. Thank you, Eileen.
You're welcome.
Sherry, we heard about the emotional aspects. We heard from Eileen sharing her experiences. And based on our conversations, we talked a lot about the different types of grief. Grief is sometimes placed in a box where we only see it in one way. But can you talk about the different types of grief and how grief plays into all of this?
Yeah. I'm really glad you asked me that, because I think there's a tremendous amount of grief in being a caregiver to someone, with a progressive illness like maybe ALS or Alzheimer's, or someone with a serious illness, even a terminal illness like cancer, or there's many other illnesses that will end in death. And I don't think we focus enough on that. I think that we tend to think, well, no one will really grieve until something happens. The person with, Alzheimer's will die, or the person with this disease will die. And I think that's actually inaccurate. I think that we grieve in two predominant ways while we are caregiving someone with a very serious condition. I think the first thing we grieve is lost time. Lost time. We had plans. Eileen had plans. I think I have a friend on the call tonight, caregiving for someone. They had plans. And Donna and Trikisha had plans with the people they're caregiving for. And either of those plans get dropped or they get altered in some significant way. And so we're looking at plans that we might have made that are not going to happen. We're looking at a future that we had thought would exist that is not going to happen. So that's sort of the lost time piece. I think the other way that we significantly grieve during caregiving is we have anticipatory grief. I mean, we know that there's a pretty serious risk of our loved one having all kinds of things that could go wrong during medical treatment, for example, surgery. We know for some people that we're caring for, the final outcome will be death. And so there's a lot of anticipatory grief about, and even just from day to day, I think going back to what Eileen said about the new normal, that, we can't be predicting what's exactly going to happen down the pike next week or the next month or the next year. So I think we're anticipating what's coming next for me, for the person I'm caregiving for, and what does this mean, and what is the impact going to be? And then, unfortunately, for some of us, we do make that transition from caregiver to mourner because the person we're caring for does pass away. And we then we go into, I think, full-fledged mourning. I want to say, many of us may have heard of Brene Brown, who's a psychotherapist, a well-known book author. I think she was actually on 60 Minutes, so she's pretty well-known. I love this quote from her. She said, "One day you will tell your story of how you've overcome what you are going through now. And then it will become a part of someone else's survival guide." I love that. Love that.
That's beautiful. Someone else's survival guide. Talking about survival guides, remember when we were planning for this discussion and we're like, oh, we have to talk about grief because it's a part of it. But how can we make it kind of bubbly and, even fun, but still realistic? And so we talked to Donna. So Donna Davin has been very intentional about her grieving, but also rebuilding after the loss of her husband. And Donna sings in a choral group, and I'll let her tell a little bit more about herself. Welcome, Donna.
Thank you. I'm really happy to be here and to be able to tell my story, and hope that maybe some of you might pick up a nugget that could help you as you go through this journey. My name is Donna Marie Davin, and I was my husband's caregiver for 3.5 years. And for me, my feelings of loss started immediately from when the doctor said to him, "You have cancer." Right then and there, I knew that our normal life was over. And I was really terrified. I was sure that he was going to die soon, and then I would be left alone forever. So because of that, I was immediately thrust into the roles, like Sherry had talked about, of being a social worker and being a nurse and being a patient advocate. But what I really wanted at that point was for everything to remain the same. The problem is that when you have a cancer diagnosis for someone you love, nothing remains the same. For us, cancer closed down the horizons of our lives to the walls and the schedules of the hospital. His pain, the chemo, and the schedules that he was on, it limited and changed what he could do, and therefore what we could do. Things that we previously took for granted, simple things like going for a walk or riding our bikes together, or even going for a ride in the car, or having sex, or the ability for him to concentrate so that we could have a long conversation. And especially since he was diagnosed fairly young, we lost our ability to plan for the future. So at some point, all of those things became lost. And I felt each one of those losses acutely and very painfully. A part of us was diminished or was simply gone. And each of these changes made me fear for the day when he would be completely gone. But when that day did come, I was still not expecting it. Even though I knew that it would come, I was just not expecting it. And that loss was like none of the other experiences that I'd had along the journey. It was like a bad dream, and I was very desperate to just wake up. The immediate demands of having things to do kept me in a state of very busy detachment. But then when the funeral was over and the family all went home, my whole world just burned to the ground. I felt like a zombie, just lurching through the dense fog of grief for the days and the weeks and the months that followed. I was like compelled to reclaim him and try to find some sort of happiness. I read so many books dealing with grief, searching for answers. I went to the Holy Land, seeking escape and comfort. I had access to multiple 6 or 8 week bereavement programs. And for 32 weeks, I participated in one after the other, looking for comfort. I had a private grief counselor too, because all those groups was not enough to take that pain away. I believed that feelings were neither right nor wrong. And so I let them all out. And then when I got through all of that, and I still wasn't really feeling happy, I decided to take advantage of being single. And I decided to do all the things that I or we, when he was sick, were not able to do. So I traveled abroad. I joined 2 singing groups and a fitness club. And with the music groups, I have been able to sing at the Kennedy Center and sing abroad. I mean, who knew that these things would happen to me in my very sad state? I could do whatever I wanted to. I biked, I hiked, I walked, I helped people. I established rituals that comforted me and helped the family celebrate and remember him. My husband died 6 years ago, and I loved him with all of my heart, and I will always love him, but now it's in a different way. Grief still happens to me, but I know at this point that I will not be stuck there in that place. I choose to do the things that make me happy, and I really stay away from the things that don't. By the grace of God and the love and the family and friends, and a willingness to accept grief as a part of my life, as well as the ability to choose new experiences, I am once again appreciating and enjoying the life that I have. And I never thought that would be possible, but it is.
Thank you, Donna. What a powerful story. Thank you so much for your bravery, your courage through that process, and for sharing it with us tonight.
You're welcome.
Absolutely. Yeah, it's
Hopefully it'll help.
beautiful. Sure it will. Yes. Sherry, what a great story, right?
Very powerful, very powerful.
Absolutely.
I think that when we become a mourner, as I did and as Donna did, we feel such intense grief at the beginning that we think we will always feel that level of grief at that intensity. And I think Donna did such a great job of showing that it does modulate. And I said at the beginning, Yolanda, with my story, that I was living my best life 16 years ago when I was married to the love of my life before he was diagnosed. I want to say I'm living the best life, my best life again now. So we don't stay stuck. We don't have to stay stuck, even though it's a very hard thing to go through. I don't want to minimize it. Don't have to stay stuck. And cope.
Yeah, absolutely. So speaking of coping, can you share some of the coping strategies based on your experiences working with caregivers? We heard Donna's story and some of the things that she's done to get to where she is in her place of healing and her journey. But what are some of those coping strategies that may be very useful to our folks here tonight?
Yes, I'm happy to talk about it. And I think both Donna and Eileen have given great nuggets already about some of the ways they cope, the HALT method that Eileen mentioned, and some of the things that Donna talked about in terms of, okay, I'm single now. What am I going to do? How am I going to make, as Mary Oliver would say, the poet, how are you going to live your one wild and precious life? So the first thing that comes to my mind in terms of coping, and we know that coping is really important. All of the research tells us that, there's been some research on the emotional lives of caregivers by the American Psychological Association. And that research tells us that, caregiving can be very hard. And it's not even just the tasks that matter, it's seeing our loved ones suffer. That can be very stressful. And yet, if we can find ways to actively cope, we will actually do better. And the person we're caring for will do better. So the first thing that comes to my mind is to have boundaries. Now, boundaries might be a professional word, but it really just means have limits. And, it's great if you can come up, let's say that you're working with someone, you're not even a caregiver now. You're working with people who may become caregivers, or maybe you're on the call tonight and you're a new caregiver. It's great if you can develop, especially at the outset, a terrific caregiving plan. And if you don't know how to do that, I would recommend, we're going to talk more about resources. I would recommend a great article that came out January 19th this year in the New York Times called How to Make a Caregiver Plan. And part of that is setting limits. We need to be flexible as caregivers, and yet we cannot be 100% available all the time. So what having limits does is it helps us as the caregiver from overfunctioning in such a way that we would become so depleted that we probably wouldn't be able to take very good care. We do need that halt that Eileen mentioned. So sometimes it means we say no to people outside our house. Sometimes it means we say no to the person we're taking care of. And sometimes it means we ask for support, because it really does take a village. And another way that many of us cope is by relying on spiritual practices or religious or faith-based practices. And I think this is important because we said earlier that our brain does go negative. And so I think our spiritual practices, our religious practices really help us develop a very positive perspective.
Thank you. Thanks for sharing that. Speaking of positive perspective, we have one final story to share with you all. Trakeisha McNeil is a project manager. She joins us tonight. Trakeisha is described as down to earth. She's witty. She loves to have fun. And she is described as resourceful. Good evening, Trakeisha.
Good evening. Hello, everyone. Can you hear me?
Yes, we can. You sound great.
Great.
You look great.
Yeah.
Thanks for
Awesome.
being here.
Thank you.
Trakeisha, I'm going to give it to you and let you talk about your experiences, and especially with that positive outlook when it comes to coping as a caregiver.
Sure. So in early 2002, my mother was diagnosed with triple negative breast cancer. At the time, I was unemployed, trusting God. I was walking in my faith, saying affirmations, praying, doing Archangel, doing the work to manifest employment because, financially it was a difficult time. And with all of that, life just knocked the wind out of me when my mother told me the news. And when we entered the oncologist's office in February 2022, everything was moving so quickly. It was like we didn't have room to digest the news. It was like we had to hit the ground running, port in, check, chemo, start within 72 hours, stat. Like these were some of the instructions, that were given like almost instantaneously. And we didn't know what the road ahead of us would look like. We didn't even know that we would have support. I just remember one time that a good friend of mine battled cancer, and we cooked for her, we cleaned for her, we babysat, you name it. And I thought that the same would be extended to us, but I was wrong. But what is really unique about my mother is that she didn't accept that diagnosis of cancer. See, she was very strong. She has a very strong spiritual background, and my mother has a very strong faith. So the narrative for us was, I'm healed of breast cancer, despite what the tests say, despite what the chemo, despite the surgery, despite the radiation, despite it all, right? And, you know, we were on autopilot here, just going with the flow. Initially, it was like smooth sailing. I remember sharing in a caregiver support group, like, wow, aren't we lucky? No real sickness, no real setbacks until it all came flooding in. And once things began to sink in for me, I had tears. They were like trapped inside of me. And that was just like the only way I can describe it. And I was like, God, what is going on? You know, I was mad, to be honest and transparent, I was angry. And I asked, why us? Like, why my mother? Because she is such a strong and giving woman. And the spirit said to me, why not?
Mm.
And my mother was drawn to the book of Job. And when he lost everything, but God restored him. And I had to feed off of my mother's resilience. You know, sometimes people make promises that they would help and they didn't. And it really made me understand that it was a critical time for me to up the ante on my faith.
Mhm.
You know, one hard day I recall looking at my mother because I was just going through some of the disappointments. And I was just like, it's just you and me, kid. I was saying that to my mom. So I had to dig deeper. I had to stay grounded by prayer, meditation. Sometimes I played my sound bowl, do yoga just to stay anchored. Affirmations help a lot. Healing and spiritual music even more. And the emotional support from the women in the caretakers group was unmatched, or I should say is unmatched, right? Being a caregiver requires you to put your life on hold. And yes, sometimes I find myself resentful, but I remind myself to practice gratitude. Even today, it's not always easy to have faith and understand why God appointed us for this journey, but it's a part of our story in that we know God will repurpose this journey to help others in some shape or fashion. Because why else would the universe trust us with such a heavy burden?
Mm.
So I could spend an hour walk you through my journey, but you know, we don't have that time. So I would leave everyone with this. Find something to keep you grounded. If you have a spiritual background, dig in. I know I had to. If you believe in the power of the universe, use that. Journal. Connect with the moon, do your rituals, buy crystals, cry if you have to, meditate, practice yoga, hey, even eat some ice cream, right? But most of all, find gratitude because it works for me. And I feel like it works best for me. And I'm so grateful and thankful for your time.
Thank you. Thank you. Thank you, Trakeisha. What an amazing story. And you're an excellent storyteller as well. You know, you shared so many amazing nuggets about resilience. That seems to be a common thread tonight, leaning on your faith and just relying on fun things. But my favorite was ice cream. You know, I use that anyway, you know, yeah, that's a kind of a coping mechanism for me. It's ice cream. Thank you so much, Trakeisha. We appreciate you and you sharing your story and about your mom and all of the great things that you do to stay positive as a caregiver. Sherry, that's a great segue
Well, it
to,
is
yeah, to
we're coping.
absolutely.
And
And go ahead, Sherry.
no, you go ahead.
Okay. So, I was just going to say that that's a great segue to move towards wrapping up and hear
Yes,
from our audience.
yes,
But I'd love for you to share some final daily practices
I
briefly
am. I will
and
briefly. I'll be
resources
very
that can
brief.
help
I'll be very
caregivers.
brief. And I
Thank
just want
you.
to say how inspired I am listening to Eileen and Donna and Trakeisha. I feel so honored to be in their presence tonight and to be in their presence every month when we have our caregivers group at Wellness House. They shine the light. They shine the light, and it's so important. So both Trakeisha and Eileen mentioned gratitude. Oprah said, if we only say one prayer and it's thank you, that's enough. That's enough. So just, a couple of little quick ways to practice gratitude. Every evening, write down one thing you feel grateful for that went on that day. Just make sure every night you do it for maybe a month, write down something different. Every morning, think about someone that has done something to be helpful to you and send them a quick thank you text. Your phone. This is a great one when you're waiting at a hospital or you're waiting for a doctor's appointment. Every day, add an image, a photo on your phone of something that you feel grateful for. When you're sitting around waiting for a healthcare appointment, start scrolling through those images you've collected and remember all the gratitude that you feel. Journal positive experiences. Those are very, very important to have some positive experiences. And I want to just take a couple minutes and mention I'll mention one quick breathing technique because it's very new. It came out in January. It's been researched by Stanford Medicine. It's called cyclic sighing. I didn't have this available to me since it just came out this year. When I was caregiving my late husband, I do it all the time now. And here's how you do it. You take 2 inhales through your nose, followed by 1 exhale through your mouth. And I'm just going to show this to you. So if you can watch, I'm going 2 inhales through my nose, a sigh through my mouth. And those medical people up there at Stanford, up the road really from where I am now, they found that if you do this for simply 5 minutes a day, 5 minutes a day, which is not much, for an entire month, it does 2 things. It makes our mood better, more positive, and it decreases our levels of stress. So I want to leave that with you. I want to also leave one more thing with you. We talked about peace. I'd like to leave you with a quote about peace. It's one of my most favorite quotes from a very wise Buddhist monk named Pema Chodron. Be the sky, not the weather. Don't let someone pull you into their storm. Draw them into your peace. Thank you so much for everything from everybody tonight. I'm so grateful to be here and to have this opportunity. And I wish all of you a peaceful journey as you caretake or as you support caretakers.
Absolutely. Thank you, Sherry. And thank you to the folks, the women who came on tonight with the courage to share their lived experiences. We appreciate you, but we want to hear from all of you. So Sherry, let's go. I'll go to the questions in the chat first, and then we can also dialogue with the audience and through verbally for those who feel comfortable speaking out loud. Jane asks, how can caregivers expand the caregiving circle, like inviting in reluctant siblings, other relatives, so we don't burn ourselves out? Great question, Jane.
That's a great question. I mean, I'm happy to deal with it, and I want any of my 3 caregivers to jump in as well. It's a great question because it's a very common issue in caregiving. I want to go back, though, to that concept of boundaries and limits. The great thing about having that and doing a caregiving plan is everyone that's impacted by the person that is getting the care, their family, your family, friends, neighbors, faith group, yoga group, whatever. If you can let them know at the outset and share your caregiving plan, or just let them know that you have times when you will not be able to do something, and ask directly for help. And if you get that sort of, if you're met, hopefully by not too many people, but with one, maybe from one person with resistance, if you just say very matter-of-factly, I hear that you're very busy right now, and I really appreciate that. I just want you to know that I'm not going to be able to be on this journey alone. And I'd really be great if you could commit to doing one thing. And then you may need to ask for what one thing is. We do need a tribe. We do need a village. And so we need to be attentive to places where we can bring people on to help us. And I know some caregivers that have actually had so much difficulty getting family to help, they've used paid respite care. What it takes to do it. We have to have time out from caregiving. It just doesn't work otherwise.
Keisha is reiterating the same point in chat. She says, I didn't have the luxury of having family to help, so I had to hire a caretaker for long hospital stays. That helped me so much and took the stress off of me. So hopefully that's helpful, Jane. And also having your siblings, hopefully in the early stages of your plan, your caregiver plan, that could be helpful as well. We have Debbie who says, please share suggestions for a caregiver whose spouse, the patient, is unwilling to allow caregivers to participate in his care. Patient will not allow caregiver to attend medical appointments, assist with medications, or even ask questions. The caregiver is hurt and wants to support her husband. Excellent scenario. Tough scenario, right, Sherry?
That's a tough one. I read Carolyn Hack's every day in the Washington Post, and I think that would be a great thing to write to Carolyn about, because I think she's really astute in these situations. Well, I want to say there's a couple of reactions I have, and again, I'm going to also encourage my caregivers to jump in too, although I know that none of us have had that exact experience. We all have been caring for people that allowed us to participate. I will say this. My late husband, Jay, was a very proud man. I'm proud in the sense that he needed to feel a great deal of autonomy. So he did not want me going to every medical appointment. He would not, and it kind of worked out because I am squeamish. He had to eventually give himself shots in the stomach. I volunteered to do that. And I guess fortunately he said no. There were certain things he did not let me do. It is unusual. Your situation is unusual though. And I want to address your part of it, because we can sort of never control what someone else does. We can really kind of only work with ourselves and control our reactions. So yes, I imagine you, Debbie, are feeling shut out. I imagine you are feeling hurt. I also imagine that it's greatly impacting the kind of caregiving that you can provide because you are in the dark. I'm guessing there's a lot of emotional reasons why your husband is behaving this way. He may be very distressed about his diagnosis. He may be very upset about it. He may also be trying to be protective, though. Maybe he is trying actually to look out for you and to be protective of you so that you don't get exposed to things that he thinks are too dark for you. So he may be trying to do that. So the question for me would be, if I were in your shoes, how could I deal with feeling hurt and feeling shut out? And I think I would just do what I talked about earlier, like try to not go down the rabbit hole with that. Like acknowledge it. I'm feeling hurt and shut out. And I would definitely say that to your husband. I would say, I'm sure you have your reasons. I want you to know I do feel hurt and shut out. And I think it will impact the kind of care that I can provide for you. And then it really becomes a question of you taking responsibility for working with your feelings of being hurt and shut out. And again, trying to think about, are there any ways in which you can feel any gratitude? Are there any ways that you can train your brain to scan for positives in that situation? Are there any nuggets there? So you're going to work with your own feelings.
Thank you for that. Debbie can share that with the person. This is a scenario that's Debbie sharing with someone that she's working with.
Okay.
So hopefully those are some great nuggets for Debbie to relay to that person. Thank you.
That's a very tough situation, Debbie.
Yeah, absolutely. We love to hear from folks. Feel free to take yourself off mute and ask us questions out loud. Donna has her hand up.
Yeah. I would like to say that when being a caregiver, I found that I had to learn to respect my husband in a different way. And I wish I had done better at this, but I needed to respect him and his own coping mechanisms. And as a result, how he wanted to deal with the cancer. Like I wanted him to acknowledge that this is bad and we have to do everything. And his attitude was, it's going to be all right. And to me, it was like he was denying the whole thing. But I needed to respect where he was coming from and how he wanted to cope. And I think that that's true in this situation, where the caregiver doesn't want the help. And we have to, I have to look beyond my own needs to look at what his needs were and then meet my own needs, however I did that, either with prayer or with exercise or all the coping mechanisms that I used. So I think we have to not take it personally when they don't want us to do the things that we want to do for them.
Great point.
Yeah, we have another question in chat. And this can be for anyone, Sherry, or any of the women who share tonight. Do you have any tips regarding balance? Say you are an only child trying to take care of a parent, and your husband might feel like you are spending too much time with your parent and not enough time with him. You feel torn. Great question.
Great question. Yeah. That's also that sort of is in the same category as the question before, I think. That ultimately we can only control so much. And Eileen talked about this. What you can control are your reactions and your choices. And so it sounds like you're feeling, whoever, or if it's for someone you're working with, this caregiver is feeling caught in the middle between, her husband who wants something and then the parent that she's trying to caregive for. It's like the sandwich generation, right? That we talk about, like you're caring for your children and then your older parent needs help. And how do you balance those needs? And I think I want to see those limit setting and
Uh-oh.
setting and boundaries,
Oh,
because you're going to have to make choices all the time. Your parent may have a health crisis, and in that moment, you're going to choose to go to your parent's health crisis, and that may cause an issue in your partnership. And so there may be, I think the deeper part of this question, which I really like, is what are the ripples? We thought caregiving could be looked at as a roller coaster and waves, but what are the ripples? When we care for someone, what are the ripples that our spouse may feel who's not as involved? Or maybe our adult or our younger kids may feel because they're not as involved. And there's this feeling maybe they have that we're taking time away from them. And so we may have to have a very direct conversation with that person about, I feel like I'm kind of caught in the middle here. I need to respond to the health crises of my parent. And at the same time, I know you have needs and the marriage needs attention. And I also have my own needs I have to respond to and take care of myself. And, this may be a good time to get some individual or family or couples counseling as well. Let's not rule that out. Also, let's mention online support groups. There's a great online support group for caregivers hosted by AAP. It's on Facebook. It's simply called Family Caregivers Support. A lot of these kinds of dilemmas show up online in that group. And I'm amazed and impressed at the kind of support and the kind of responses that caregivers get from that online group. So I think this is a great time in this situation to ask for more support, more help from your tribe, and consider some professional help too.
Yeah, can I just make one comment about that? There's
More
hospice.
than one.
Hospice of the Chesapeake has supportive care. They have a supportive care group, and part of that is a social worker, and the social worker will come to the home, and that might be a way to facilitate the conversation with the husband regarding defining balance and what do we need to do to create balance so I can take care of the parent and also be present to you. And I think having a third person facilitate that might feel better as well, just depending on the nature of the relationship between the spouse and the wife. But that's just my thought about that.
Great point.
And I think balance needs to be redefined. Like your picture of balance may be, when your mother was healthy and you took her out to dinner once a month, and now balance is going to be completely different because her needs require, demand more of your time. So again, all of that I think needs to be negotiated in a conversation.
thank
All
you.
that renegotiation.
Yeah, and I also wanted to add that we're going to be sharing a list of resources that Sherry provided. That resource list is going to go out with your survey. So it's another way to get you to also open your survey because it will be a part of that as well. So just to let you all know, we will share that. Sherry, I do have a couple of questions that were shared directly with me
Yes.
from folks who knew that I would be facilitating this discussion that I'd like to discuss. One is, how do you deal with the dichotomy of knowing your husband has stage 4 cancer, but feels and acts normal? And then the other question is, how can we make the best use of this time we know that may not last?
Oh man, those are like both such terrific questions. I'm going to take the second one first about making the best use of this time. It's funny because when I did my walk today, I was actually thinking about that myself. I was thinking about when you are caregiving someone and you know that eventually the person, I mean, we don't know. That's the thing though. None of us really know. I could have could have died before Jay. I didn't. You could, but theoretically, if you believe the person you're caring for will end up and will end up with a transitional experience we call death, what is the way to make the best use of the time? I can say that my husband and I talked about that all the time. And we decided we wanted to keep things as normal as possible. For us, that was the way to do that. I also want to say that I don't think there's one right way to do it. I think it really depends on you and the person that you are living with and caring for. We had some friends of ours out of state that also our friend, the wife, was caregiving for her husband with cancer. They didn't handle things that way. The husband took a sabbatical from work, but neither my husband nor I took sabbatical. He did, and they spent the time traveling. They did a lot of traveling. They traveled, a lot of it for pleasure, places they thought they might not get that they really wanted to go to. They did some traveling with family. They had adult children and grandchildren. So I don't think there's a right way to handle that. I think what I think is very important, though, is to have that conversation with the person you're caring for. Be explicit about it. Get it on the table. Say, how can we make the best use of the time we have while we have it? What do we really want to do? And be intentional about it. And then the first part of the question is about how do you handle the dichotomy between, like in my situation, Jay was given a terminal diagnosis. He was told by several medical people he would die. But he wasn't qualified to get surgery, but he went through chemotherapy. And there was a period, it was very short, there was a period when he went in remission. And he was kind of like Donna's husband too. He didn't want to hate cancer, think about it being bad. He wanted to stay very positive, and he wanted to believe that he would beat it, even though probably knew that he wouldn't. So that's a hard dichotomy because, again, I think as the caregiver, I have a lot of anticipatory grief that I don't think my husband really had. I think he got better with chemotherapy, and I think there was a small window when he got better that he believed he would beat it. And there was probably a small window when I would believe he would beat it too. And then our world kind of came crashing down because very quickly he went from bad to worse, and he lived about 6 weeks after going from bad to worse. And so I think, again, I value openness and directness. I think having conversations between the two of you about what's happening, and it's an illusion maybe to think that you're getting better, and yet miracles do happen. I believe in miracles. And so, I think kind of honoring where the person is, and like Donna said, respecting. We have to learn to kind of respect where they are, even if it doesn't jive where we are as the caregiver.
Thank you. Thank you for that, Sherry.
You're welcome. Thank you for the questions.
Yeah, absolutely. Any other thoughts? We do have a few more minutes, and even if you have final thoughts and maybe you don't have a question, or just kind of some things that may have come up for you, or things that you would like to share, highlights, takeaways.
Because some of us have been doing a lot of talking, and we're happy to listen.
All right. This is good. Sherry, I think this conversation was highly valuable. You all share some some powerful stories. I'm going to go back and listen and take some notes, some really good tips. If anyone would like to say anything to the speaker or our folks who are here now, like any board member or anyone, feel free.
I'll speak. I really want to thank, I very much want to thank Dr. Premier, and thank you to the three ladies who were kind enough to share their personal experiences. All of your experiences are so meaningful for what we're doing and so helpful to understand if we haven't experienced the role of caregiver, what it is like, which is really important for us when we're talking about the people that have that role or might have that role. And I appreciate that we have this resource now. This is an important resource for us to share and make available for other people to listen to. I think it will be incredibly valuable. So again, thank you so much for the time you took to prepare for tonight. And thank you for the open and very informative conversations.
Thank you for asking us to be here. Really grateful to be here. Thank you. Thank you.
Thank you.
I just wondered if we had anything, if Candy had been able to get into the chat.
Not just yet, but Madeline, who is also on the board of the Oncology Foundation of Maryland in the District of Columbia, she says, thank you to all of the speakers. Very powerful and meaningful stories shared with love, solidarity, and compassion. Lisa has also shared the link to the survey. We will also make sure that the resources are put in that survey as well. So please take the time. If you're not able to pull it from the chat this evening, you'll also get it in an email with a link to this recording as well. Somewhere between early to mid-week of next week, you'll get that in your email. So keep an eye out for that. This has been wonderful. It is 8:15. We want to be mindful of your time. I want to give just a minute for anyone to share one final thought, if you have it, before we close out. All right. Thank you, Pam, for having us and driving these critical conversations. Thank you to the board. Thank you, everyone. Please follow us on our website. Take a look at all of the great work that's being done by the Oncology Foundation of Maryland and the District of Columbia. Have a great evening.